gender health this morning.
All right, she's trying to help us feel a little less lonely, especially with the holiday season coming up. Good morning, Dr. Saunders. How are you doing today?
I'm well. Good morning, Caitlin and Scott.
You know, we were just doing a story. I was doing a story at a delicatessen the other day, and the woman was talking to me. She said it's a little upsetting to her because she used to have teams of people at her house, and teenagers and adults, and now it's down to 4 people. And, you know, she said the holidays can get a little depressing because you remember what was and what is. And so, you know, how do you combat that?
So I think you're bringing up a really good point, and that's human beings are social creatures, right? Our connections to each other is what helps us to survive and thrive. Yet sometimes as people age, they become more alone or more disconnected. That's through losses. That's through people moving away. So it really leaves us very vulnerable to social isolation and loneliness. And there's been a lot of research that has shown that social isolation and loneliness is related to some very serious and significant health problems. Cognitive decline, depression, heart disease, obesity, high blood pressure, weakened immune system, memory issues, and dementia. So it's actually a very serious social health problem.
Wow. I mean, Scott was just mentioning that connection between having a dwindling crowd. But I mean, for a lot of people going into the holiday season, they remember the people that they've, like you said, who they've lost. I think the pandemic has changed a lot of gatherings for people as well. And we've lost a lot of time in the last several years with the way that just we were able to kind of gather.
Sure.
What's the difference, do you think, between feeling that isolation or feeling loneliness?
So that's a great question. So yes, we've been through a global pandemic for the last almost 3 years now, right? Where no one had ever heard of the term social distancing before, right? So that was like a new thing, but it created social isolation, which social isolation is that more objective separation. People were separated from other people because of the global pandemic. Now, loneliness is that more kind of internal, subjective, distressed feeling of being alone or separated. And as they say, you can feel lonely in a room full of people, and that's really feeling emotionally disconnected. So it's important to acknowledge those things. What we need to do is we need to identify those people who are most prone to suffering from social isolation and loneliness, and those who would most benefit from interventions.
What effect can social isolation and loneliness have on not only mental health, but physical health? We're talking about it can really wreak havoc on a person's system.
You said like obesity and heart health. Those are all issues that people should look out for, right?
Right. There's some studies that actually show that loneliness and social isolation is more of a risk factor than smoking.
Wow.
In death. So it really is very serious. And, you know, one of the factors is they really feel that the depression and the isolation weakens the immune system so that you're more prone to have negative health events happening. So let's do this as we move into this holiday season. Reach out to people that you haven't heard from, you know, that aunt or that uncle or that grandparent or that great aunt or that neighbor down the road. Reach out to them, bring them a plate of cookies, have a cup of tea with them, do something to make these connections, because those connections are life-saving.
And, you know, those connections will actually help you as well as them.
For sure. And Dr. Saunders, you just mentioned like identifying those people who might be suffering from some of these things. Can we do anything to prevent this or prevent the feelings of loneliness or isolation? And I know seasonal affective disorder is a different topic for a different day, but
yes,
there's a lot of factors that I think come into play, especially around this time of year. What can we do to try and help ourselves?
I often worry that social media portrays that there's all these beautiful families that have all these beautiful connections, and that social comparison often makes people feel more inadequate about themselves. So reaching your hand out to someone you haven't talked to, checking in on that neighbor, making an effort. It's actually a community responsibility, not just any one individual, but doing those things can really be life-changing. And as you said, it makes you feel good. When you do something to connect with someone else or brighten someone else's day by having a cup of tea with them, it makes you feel good about yourself. So the good feelings go both ways.
All right. What time is dinner on Thanksgiving, Doc?
It's at my sister's house, so I hope you're joining me in New Jersey.
Okay. You never know. Thank you, doctor. We appreciate your time.